glucose levels, and it's pretty cool. It's all working now. This, of course, the lab's a mess, but that's okay. It's a working lab. You put the blood on the strip, and then you when you're ready to take a picture, you go, and then so this is our fake picture at the moment because it's doing a test, so that you can see. When you add glucose on it, it changes color, and so all the phone app is doing is taking a picture of the strip and then analyzing the color, and then from the color scale, from what it reads on the strip, it can actually get the glucose level. So you can eyeball it, you know, if you really don't have a phone. So that's a thing in developing countries. If you're really with no power or whatever, you can actually estimate your blood glucose level. But with the phone, you can actually get a number. Most people in developing countries have cell phones. Studies looking at diabetes that MUSC, our collaborators, just completed one, and they saw huge rates of diabetes compared to what was measured 10 years ago. And I don't remember off the top of my head what the factor was, but it was something insane, like 10 times. Like it was crazy. And so diabetes, the chronic diseases that you don't normally associate with rural areas in developing countries, because they're exercising, right? They're not what we typically think of here, but the diabetes, hypertension, and kidney disease were huge, and it's being recognized. Last time we went over, I was there in the summer, and then one of my colleagues from Tanzania came here for the Global Health Symposium that MUSC had, and I think in the last couple of years you've seen a shift that the public, people talk about it. So it's one of those, it's like in the US, everybody knows, they're starting to see it, and you have, you know, my aunt or my father or somebody has one of these types of chronic disease. And then it's just convenient not to have another device to carry. That was the other idea. So it was really for that first, but we do have people interested in the US, and the startup's working on the manufacturing and the regulatory process. While the regulatory process, it's going to take probably, I guess, like a year to just get all the FDA approvals. The manufacturing plant should be done by then, and the app will be, we're almost done, as you saw. So we're going to sell it for veterinary products, because apparently in the US there's a larger portion of people who have diabetic pets that need to buy diabetic test strips, and they buy them out of pocket. So this would be a much cheaper alternative. I think the goal is to have the strips sell at around like 5 cents a piece, and then since it's already on your phone, there's no additional device. Yeah. So Jackie's gonna find out other cool toys.
There's a lot of fun stuff.
Oh, we do. Your project's cool. I don't know how well it'll photograph, but it's really